Good evening, everybody. Tommy Jordan, Stanley County Commissioner, coming to you to talk about the COVID-19 vaccine shortage that's about to hit North Carolina. Don't freak out. Don't panic. Don't worry. I'll tell you all I know. It's going to take a few minutes. I'll try to make it brief. North Carolina is ninth in the nation for administering vaccines so far. We've delivered about 606,000 vaccinations to date. We have 195,000 vaccinations left to be delivered before Monday. When that's done, for whatever reason, above my pay grade and above quite frankly, our state's pay grade, we don't have a lot of vaccine coming in next week. It's just the way it works. It sucks because a lot of these small counties like Stanley have worked very hard to ramp up and to perfect a very imperfect system and have finally got the ball headed downfield fairly reliably and have built up their vaccine protocols and been able to vaccinate more and more people every day and man the phones every day and make all this as smooth as they possibly can, only to really get in their stride and have the state say, by the way, the one thing you're not going to have is vaccine. Well, crap. That's going to make things difficult. It's not going to be for long. It's going to be for a couple of days. And don't be fooled in thinking this is the only time in this entire pandemic it's going to happen. It's probably not. This is likely to happen again before this pandemic is over. So it's up to us to how we react to it. And how you react to it as the general public is going to determine how well the mental health of our county health department can be sustained, because there's very few of them and there's very many of you guys. You're talking 20-some people versus 62,000 people calling trying to get information. So I'm trying to disseminate what I can, because quite frankly, my job allows me the freedom to kind of be blunt. And a lot of these other people don't have that ability. I've talked to the governor's office today. I've talked to the health director today. I've talked to the health department staff today. I've talked to county management today. So I'm as up to date as I can get. My last update was about 5:30. That was an hour and a half ago. So we are probably going around a vaccine in Stanley County sometime Monday. Probably so. We're probably going to be out Monday. We hope that maybe we can have a relationship where we can beg or borrow to get a couple hundred more doses, another 1,000 doses. But at the rate we're giving out vaccine, that's a day or two, maybe three max. So we're probably going to run out this week. Not a big deal in the big scheme of things. It is a big deal in the local small pond that we live in, because people are going to be confused. So please take a minute and share this video with them, or just tell them what I'm about to tell you. If you are calling about getting the vaccine, the only number to call is the Stanley County COVID-19 vaccine hotline. Okay, that number is 980-323-0205. It's the only number you should be calling. I had a few health department people tell me today, they said, it's funny, people keep calling our office and they've been calling us for days and they're mad that we're not returning their calls. In fact, they're calling our supervisors going, why haven't I heard back from this person? I've called her office all week long. Because they're not in their office, bro. They're out in the field, they're working. Nobody has been in their office in months. And if they've got time to sit around and take phone calls, and believe me, they wish they had time to sit around and take phone calls, they'd be doing it, but they don't. They're out there actively working this program as hard as they can. So just don't try to call their offices. Don't try and call their personal extensions. Don't try and ask them questions. Call a hotline, because this program is now bigger than 3 or 4 people. We have emergency management involved, the health department involved, the nurses involved, the call facilitators involved, the callback coordinators involved, the appointment takers involved, the CVMSP people involved. It's a lot of people. Nobody has the one answer anymore. You need to go through the program, and that's the only way it works. Okay? Now, here's the rub, in my opinion. Because the state has rolled out this new mass vaccine protocol, which is good. In case you don't know it, the state has stood up a couple mass vaccine clinics where they're going to be able to vaccinate 15,000 people in one day and 20,000 people in one day. You know what? From a holistic state view, that's a great thing. If I were the governor or someone at the state level, I'd be like, pat me on the back, good job. But I'm not. I'm the local county commissioner down here at the county level talking to my health director and who's going to commissioner. I don't have any vaccine. I was told today I'll be out. I mean, he was told, well, I'll let you know by Monday at 3 if I can get you some. Look at, he's going to be out by Monday at noon. So thanks for the call. Everybody is everybody is giving out as much vaccine as they can. We have done a great job at a state and county level of getting it out there. Please don't think that we haven't. But we have hit one of those inevitable roadblocks where we're going to be out of vaccine for a couple days. Not a month, not 2 weeks, a couple days. Here's the downside of that. It's going to bring our phone system to a screeching halt. And I mean a screeching, yelling, mad halt. Because that's the way most of you know how to contact people. You know to call that number. And that's great. I'm glad you're calling the number. Call that number. But now, here's what's going to happen. There's about 6 people manning those phones, because now we have improved our program. So when you call and you get somebody, not only can they get your information, they can actually schedule your appointment. So we've improved the system where they can schedule the appointment in real time. So it's 1 phone call, not 2. That saves a lot of time. Well, now we got that process streamlined, right? Great. Now we're going to throw this snafu in there. There's 2 snafus. There may be 3, but I'll tell you what they are. Keep in mind, you have about 6 people that can do this job. And they have to be able to work with the state system and have an NCID, and not just anybody can pop up here and do this job. But what's going to happen is when we start to run a vaccine, some of those people are going to be pulled off that phone desk and start calling people back that already have appointments to say, hey, I know you've got an appointment on Tuesday at 10, but we're going to have to change that because we're out of vaccine. So now that's going to be a bunch of people, probably 1,000 or so phone calls that have to get made, because we're currently doing 350 vaccines a day, 330 today, because 20 people didn't show up. So that's about right. About 7% just are no-shows. So we're going to have to peel people off the phone system to handle those callbacks. Meanwhile, just as many of you as ever are going to keep calling. So now it's going to be 4 or so people, maybe 5, taking those phone calls. And then they're going to have to tell you, ma'am, sir, I don't know what to do. I have to take your information and call you back when I know we have vaccine. So let's say that goes on for 3 days, and we do that. So on day 4, we're still going to have the same amount of 1,000 or 2,000 calls coming in a day, and still only going to have the same people. And now those people that work taking names for 3 days have to go call all those people back. And now instead of being 200 names, that list might be 3,000 names, which is going to take them a week and a half to get through. So just understand, it's a people problem that's caused by the state yanking the wheel out from underneath our bus as it was going down the road. And it sucks. And I know it was not intentional. They know it's not intentional. It's just a crappy situation we have to deal with. So my advice to you out there in the general public is, number 1, don't freak out. It's nothing to freak out about, okay? We're going to have a couple days. We probably don't have any vaccine. Not the end of the world. Truthfully, it's January the 22nd. We've literally survived 11 months so far. I ain't got it yet, all right? So if I don't get it tomorrow, and I don't get it for 2 more weeks, not that big a deal in this big scheme of things. I know it's important to everyone. I know we all feel that we should be number 1. But there's only a certain amount of people that have to serve 10 million people in this state. Number 2, if you call the vaccine hotline, and again, just my personal advice, if you call the vaccine hotline and they tell you, sorry, Mr. Jordan, we are currently out of vaccine, we're going to have to take your information and call you back. My advice would be, this is just my advice, it's not worth anything more than the air it takes to tell it to you. My advice would be, for their sake and yours, just thank you, Miss So-and-so or Mr. So-and-so. I'll just call you back in a couple days, and hang up the phone. Don't give them 2 phone calls to make, because you're still going to have to wind up calling them back, or they're going to have to wind up calling you back while somebody's calling somebody. Just don't give them the extra work. If you hear that we're out of vaccine, my advice would be to say, thank you, bless your hearts, let us know when you get some more. How about I just call you back in a couple days and go on about your day? That's how I think you should handle it. I hope people do. I know a lot of people don't handle it that way. They get mean, they get nasty, they're frustrated, they're tired, they're scared. I understand that. They understand that. These people, I wish I could just take the phone and drag you around the room and show you these people that are doing this job, and drag you out there and let you see them working. They're crushing it. They're killing it. They're working as hard as humanly possible. And most of them are doing the jobs of 2 or 3 people, because all their normal jobs still have to get done. And now they're doing COVID testing, and they're doing COVID vaccine, and they're running the health department, running EMS, and handling 911, and they are overburdened as they can be. And this particular snafu by the state or federal government, whichever one's fault it was, did not make things any better for us. In fact, it was probably the worst thing that happened to us since this program got started. But it is the reality we have to live with, not the one that we want. So be patient. My advice would be just call back. I'm hoping that maybe the director can change the phone system to say something like, if we're currently out of vaccine, if you'd please call back on such and such a date. I hope they'll do that so people know, but I'm not sure if they can or not. Be patient. Spread the word. We know we're going to run out. It's short term. We're going to be fine again soon. Okay, a couple days, we'll have more back. We're probably going to run out again. It's going to happen more than once. There are more people trying to get this than there are people are doses available to be given out. Okay, and the system's not perfect. No one ever planned to have to give any one thing to every person in the United States in a short amount of time. I don't care if it was a dollar bill, a cheeseburger, or a vaccine. Distributing something to 350 million people and then doing it by age group and doing it by whatever random factors that they determine is an insurmountable task, and they're doing the best they can. Have some patience. Have a good weekend. Stay safe, stay warm, and have a good day, y'all. I'm out.